Anyway.
Okay, you know, another of the many side effects of the pandemic is that people are paying more attention to their physical boundaries. No more handshakes or hugs
Don't
with
ask
people
Garth Brooks about that.
you've just met.
He's hugging people all over again.
Not to mention the four walls of your home when we're all staying inside.
Yes, but there are emotional boundaries as well, and those are important. Here to talk about how to set those up, we welcome back on Skype licensed psychologist Dr. Karen Ryan from Nystrom and Associates joins us again.
Hi,
Dr. Ryan, it's nice to have you back.
Hello, good to see you both.
We love having you here. Okay, let's talk about emotional boundaries. These are important. How do we do them, and really, what are they?
Yeah, emotional boundaries are simply where you begin and end and where another person begins and ends. And so recognizing that you have separate thoughts, separate feelings, separate behaviors from other people. So it's kind of like if you were to draw an imaginary line, here's where I start and end, and here's where you start and end.
Okay,
that's an emotional boundary.
Yeah, that we should know that, but apparently we don't. We cross those.
But if you set them up, wouldn't you just be off to the running for a much less stressful life? So considering we're all probably not great at setting some of these boundaries, let's talk about some warning signs. And you say first, blaming others for your emotions and your frustrations, that's a bad sign about your boundaries. Unpack that.
Right. Because when you think about it, each one of us, if I'm responsible for my own behavior, my own thoughts, feelings, emotions, then I need to take responsibility to recognize what my needs are. And we can see emotional boundaries are blurred when, well, if you wouldn't have done that, I would have gotten so angry. Right. So that's a blurring of an emotional boundary. Right. Another one is when we take on other people's emotions as our own. So somebody's having a hard time and then we kind of take that on. And so if we recognize that boundary and that line, kind of see that person in a bubble, that's theirs, that's not mine. I don't need to take that on or let that be my emotion right now.
Oh my gosh. I mean, this is such good talk, especially for parents of kids, where you can like take on their emotions so much.
Yes.
I'm speaking as a person who may or may not have a 3-year-old who gets slightly out of control on occasion. His name is Franklin.
Don't
He's
say
a
his name
joy.
like that.
But you know, it's if I can just step back and go, that's his deal, not mine. I find like managing the tantrum is so much better.
Yeah, what advice do you have for parents out there who struggle with that and feel like we have to really over-manage the emotional state of our kids all day, every day?
Yeah, and Elizabeth, you just highlighted it exactly, because if you pull back and say, what's my body doing? I can control my body, right? If we're trying to control or fix that other person, it's impossible. But if you say, what can I do right now to calm myself down and take care of my emotional health, then that helps you. And then that other person tends to calm down as well. And so it's really taking responsibility for yourself. And then what comes with it is knowing, oh my gosh, I can meet my own emotional needs, which feels very empowering.
Oh, that's great.
And by the way, setting these boundaries doesn't have to, we think of it as rude,
yeah,
right?
or like you're trying to
Selfish.
separate yourself from people that you love or that you're caring for.
But in reality, isn't this the best about, I don't know, sort of like a fence around your house so that you can best care for you in this case, so that you can then offer better care, love, time, and presence to the people around you?
Yep, that is exactly correct. Because if we are not taking care of ourselves and then we're in this chronic pattern of other people trying to meet other people's needs are never actually fully met. And we're always left feeling unsatisfied and oftentimes then resentful. And so that can be a hard thing.
Oh, Dr. Ryan, this is such good stuff. This is really helpful.
I have a hard
so
time
much.
envisioning Dr. Ryan yelling.
No,
She's
but I
so
bet she
calm.
could.
I'm sure she can. I'm sure she has.
I bet
I'm
she
sure she
could.
does. Oh, yes, she does. Turns out she's human as well. Really helpful
I am
stuff.
very human. We all are. That is the grace we must give
Yes,
ourselves.
preach it, sister. That is the truth. It's always great to have you on our show. Really good
Good
insights.
to see you. Thank you.
Nystrom and Associates provides care in the fields of psychiatry, psychology, family therapy, and more. They've got 20 locations in and around the Twin Cities.
And they work with couples, families, and individuals of all ages. So if you're struggling with stress, anxiety, depression, or addiction, reach out to them today. You get somebody like Dr. Ryan to help you out.
I'd tell her all my problems.
I know, I would too.
Yeah.
I would just love to start right now.
Yeah.
I might just
Bring her
call
back. Is she still there?
I know, I have so many to work through. This week,